right.
Hello, my name is Anna. I'm going to be your student nurse today. Could you tell me your full name and date of birth?
Ryan Borelli, 12/19/2005.
Perfect. I'm just going to check your wristband, and it matches. Do a quick safety survey and provide for privacy. So the bed is locked, and I've raised it to the appropriate height for me to work at. The floor is free of tripping hazards. They're wearing non-skid footwear, and she has her call light within reach. So today I'm just going to be changing the dressing on your abdominal wound. Is that okay with you?
Yeah.
Okay, so I'm just going to take the dressing off, assess the wound and make sure it's looking okay. I'll clean it and put a fresh dressing on. Do you have any questions?
No.
Okay. I'm going to just verify my provider order, and that looks good. So I gathered my equipment based on the order. And then on a scale of 1 to 10, what is your pain level right now?
About a 2.
Okay, perfect. So based on the patient's assessment of pain, I will not be giving a PRN pain med. If the patient had been feeling a higher level of pain and there was a order for a PRN, then I would do my 3 rights, or my 11 right to my 3 checks. So I'm gonna help the patient get to a comfortable position. So the position they're in right now is good for me to change an abdominal dressing. Is this comfortable for you?
Yeah, thanks.
Okay, perfect. So I'll get started now. Got my clean and non-sterile gloves. Alright, I'm just gonna pull your blanket back and then pull out and up. I'm gonna go ahead and assess this. So there is no odor and there's no drainage present, so there's nothing to assess as far as that goes. And I'll pull these out too. Again, no odor or drainage, so I'll dispose of this according to our hospital's policy. Then I'm just gonna look at your wound. So there is a little bit of pinkness, or pink on the peri-wound area, which is nothing to be concerned about. That's normal because it's healing. There's no severe redness, no swelling, no necrotic tissue, no dehiscence or maceration. It's a secondary wound because we can't quite close it. But yeah, the patient doesn't have an elevated white count or an elevated temperature, so they're really showing no signs of infection. They're not having a high pain level. So I'm gonna go ahead and measure that. For the purpose of this video, this is my sterile tipped swab. So I'm just gonna go into the wound with the deepest spot. Are you still feeling okay?
Yeah, thanks.
And measure that. Looks to be about 2.5 centimeters in depth. And then for width, about 2.4 centimeters. And then I'll get the length. And it looks like 14 centimeters. So it's 14 by 2.4 by 2.5. So that's all for my assessment. I'm gonna dispose of my gloves and my hand hygiene. And then I'm gonna open my clean new box of gauze sponges and put some sterile water in. Perfect. And then I'm gonna open my ABT and my gauze sponge. And then I'm just gonna get my tape ready too. And I'm just going to date and initial that right away. So I'm gonna get started cleaning. Still feeling no pain?
Yep. No pain, sorry.
Use my soaped sponges. Gather the four corners. Alright, and then cleaning from top to bottom, inside to outside. I'm gonna go right down the middle first. And dispose of that. I'm gonna do the left side of the wound. The right side of the wound. And then the left peri-wound area. Might feel a little cold, sorry about that.
It's okay.
Right peri-wound area. Alright. And then the wound is nice and clean. And then at this point, I would apply any medications if they were ordered. But there are none ordered, so I'm gonna go ahead and get rid of these gloves. Do hand hygiene again. Another pair of clean and non-sterile gloves. Alright, first you're just gonna feel me putting some gauze into your wound. That looks good. And then I have an ABD dressing that I'm gonna place right over top. And then using the window pane method, I'll tape it. And then I've got my tape with my initials and date on it already. Alright, so that looks good. Cover you back up. How is your pain level?
I'm doing good, probably a 2 again.
Okay, perfect. So I will come back and reassess how you're doing again in about 20 minutes. But for now, I'm gonna go ahead and go document that my dressing change is done. And thank you, have a good day.
Thank you.